Welcome to The Explainer. Today, we're diving into something that feels like it's straight out of science fiction, but it's happening right now. We're talking about multi-cancer early detection tests. You might have heard them called liquid biopsies, and they have this incredible promise of finding tiny cancer signals from just a single blood draw, kind of like a health radar for your whole body. So, why all the excitement? Well, it really boils down to this one single number: 70%. That's roughly how many cancer deaths come from types of cancer that have absolutely no routine screening today. We're talking about killers like pancreatic, ovarian, or stomach cancer. This is the huge, tragic gap that this new technology is hoping to close. And that 70% number really gets to the heart of what we could call the screening problem. You see, the way we look for cancer now saves lives, for sure, but it's also got some major blind spots, leaving us completely in the dark for so many of these deadly diseases. I mean, think about it. Our standard screenings, mammograms, colonoscopies, pap smears, they are incredibly important, don't get me wrong, but altogether, they cover less than a third of all the cancers diagnosed each year. So we're left with this patchwork system of different, separate tests scheduled at different times, and let's be honest, some of them are pretty invasive and inconvenient, which means a lot of people just don't do them. Okay, so how do we possibly fix a problem that big? Well, the answer might actually be flowing through your veins as we speak. This is where the revolution in a blood draw begins. So the key to all of this is something called cell-free DNA, or cfDNA for short. Here's how it works. Every single day, billions of cells in your body die off. It's totally normal. But when they do, they burst open and release these tiny fragments of their DNA into your bloodstream. It's almost like your blood is keeping a running log of everything that's happening inside every organ in your body. But here's the huge challenge. The vast, vast majority of this DNA, we're talking 85 to 90% of it, comes from perfectly healthy blood cells. So that creates this massive amount of background noise that can just totally overwhelm the super faint signal coming from a tiny early-stage tumor. It really is like trying to hear someone whisper your name from across a packed football stadium. So how in the world do you find that tiny whisper in all that noise? This is where the real genius comes in. The breakthrough was to stop looking just at the DNA itself and instead focus on something called DNA methylation. You can think of these as tiny chemical tags that are stuck to the DNA, and they tell genes whether to turn on or off. And here's the cool part. These patterns are totally unique to different types of tissue. So they act like a molecular GPS, telling scientists not only if there's a cancer signal, but also where in the body it's coming from. And when you break it down, the process is pretty elegant. It all starts with a simple blood draw, just like any other. In the lab, they isolate all that cell-free DNA. Then, they use some really advanced machines to analyze millions of these methylation patterns. And finally, some seriously powerful computer programs sift through all that data, looking for abnormal patterns that scream cancer, and then pinpointing where that signal is coming from. Now, with science this promising, you can bet it's kicked off an absolute race between biotech companies. Everyone's scrambling to create the test that's the most accurate, the most reliable, and hopefully the most affordable. And what's really interesting here is that not everyone is taking the same path. You've got different companies with totally different game plans. So you've Grail's Galleri test, which is probably the most famous one, and it's going for this broad approach, screening for more than 50 types of cancer at once. Then you have a company like Freenome, which is being more focused, really trying to perfect its test for just one cancer, colorectal first. And then you have other innovators like Methylscan out of UCLA, who are laser focused on one thing: making the technology cheaper so more people can access it. And this quote from Dr. Asma Shaukat, she's a lead investigator on one of these huge studies, it just hits the nail on the head. At the end of the day, the best test in the world is the one people will actually get. If you can make cancer screening as simple as a routine blood test, well, that could change everything about how many people get screened and ultimately how many lives are saved. All right, so the science is amazing. The lab results look great, but now for the real test. What happens when this incredible tech leaves the clean, controlled world of the lab and enters the messy reality of screening hundreds of thousands of everyday people? This is where the promise really meets reality. And I mean, the promise is just wow. Take a look at these results from Freenome's big trial for its colorectal cancer test. In their main analysis, it found 100%, literally 100%, of stage 2 and stage 4 cancers. And it was very specific, which means it didn't raise a lot of false alarms. I mean, you just can't ask for better numbers in a trial setting. Those numbers are fantastic. But And this is a huge but. What happens when you're not in a carefully controlled trial anymore? What happens when you use the test on huge, diverse populations of people who feel perfectly healthy? This is where things get a lot more, well, sobering. Take the Gallery test, for example. In what's called a case control study, it had a sensitivity of over 51%. Pretty good. But when they used it in a big, real-world study called Pathfinder, that sensitivity dropped all the way down to just under 29%. It just goes to show you how incredibly hard it is to find that tiny cancer signal out in the wild. So does that mean these tests are a failure? Not at all. It just means we need to think about their benefit a little differently. They might not be a silver bullet that stops all late-stage cancer, but what they might be doing is causing something experts are calling a stage shift. And there's no better example of this than the huge NHS trial over in the UK. They tested 142,000 people. Now, the test didn't meet its main goal, which was to reduce all late-stage cancers combined. But it did something else that was really important. It caused a 20% drop in the absolute worst cases, stage 4, and it moved those diagnoses up to the more treatable stage 3. So it's a subtle difference, but it's a hugely important clinical benefit. Okay, so shifting a diagnosis from stage 4 to stage 3 is a massive win, a potential lifesaver. But what if we could do even better? What's the real holy grail here? Well, the next frontier is moving beyond just early detection to actual prevention. Because the ultimate goal, the true holy grail, isn't just finding cancer when it's small. It's about finding precancerous lesions, things like advanced polyps in the colon, and getting them out before they ever even have a chance to turn into cancer. That is true cancer prevention. And this is the big hurdle for the whole field right now. That's way harder than it sounds. Just look at this. This is Freenome's updated test. It's fantastic at finding actual colorectal cancer, 85% sensitivity. But for those advanced precancerous lesions, the sensitivity is way lower, down at 22%. Figuring out how to close that gap, that's the next big mountain to climb. Okay, so after all of that, the incredible science, the promising trials, the real-world results, what does this actually mean for you today? What are the big things you should take away from all this? Let's just start with the most practical question, the cost. Right now, these tests generally are not covered by insurance. So if you want one, you're looking at paying out of pocket, and that's typically going to run you somewhere between $700 and $950. And this next point is maybe the most important thing to remember. These blood tests are for detection, not diagnosis. And those two words mean very, very different things. A positive result from one of these tests does not mean you have cancer. It means a signal has been detected, and it's the starting point for more tests with your doctor, like scans or a biopsy to figure out what's really going on and get an actual diagnosis. So all of this leaves us with a pretty fascinating question to think about. As this technology keeps getting better and better, and as the costs hopefully start to come down, how long will it be before a multi-cancer blood test, a true health radar, is just a normal, routine part of your annual checkup? The answer to that question could truly reshape medicine as we know it.